In general, the anatomy of the humerus is a little more simple when compared to the scapula. However, there are some important characteristics that I want to cover because they do directly affect the ability to move this joint and add to both the total range of motion as well as the stability. So when we look at the humerus, we see that it is a ball-shaped articular surface. That's why we have the glenohumeral joint being a ball and socket joint, with the humerus being the ball portion, the scapula forming the socket portion. We see that the head is obviously convex. That means it's rounded, ball-shaped. And again, it is approximately, and when you look at it in this picture, you can certainly see that it's about a half of a sphere, right? So it's fairly spherical, fairly round, and so on. So basically the ball shape here, if we see in this picture, is going to be the sphere that I'm talking about, and it's going to be covered with articular cartilage because that's the part of the humerus that articulates with the scapula. So again, important to note that it is round. Also important to note is that it faces medially, so towards the scapula or towards the center of the body, and the head also faces somewhat superiorly and posteriorly. So it points in a posterior direction, as we can see in this lower picture from the top. So basically this is the frontal line, meaning this is the where we separate the body into front and back halves. And we can see that there's about a 30-degree tilt of the humeral head in a posterior direction. So it faces posteriorly to fit into the glenoid cavity, which faces somewhat anteriorly. So it's positioned that way in a posterior direction. That's part of the reason why we see more frequently, we see, again, anterior dislocations of the humeral head as opposed to posterior dislocations. That's one of the reasons. There's a number of reasons, which we'll talk about, especially when we get into the functional aspect of this region. Now, that's looking from the top or above. Okay, if we look from the front, we also see that the humeral head is angled somewhat upward, and that's at an angle of approximately 135 degrees. So we see that the humeral head is again, pointed medially, superiorly, and posteriorly. And again, that all is related to the amount of motion and the directions of motion that the glenohumeral joint allows. The upward angling of the humeral head is called the angle of inclination. And the posterior kind of twisting or rotation of the humeral head when compared to the distal end of the humerus, as we see in the bottom picture, is called retroversion, or we say that the humeral head is typically retroverted approximately 30 degrees. When we learn about the hip, you're going to see that there are similar terminologies that are utilized for the femur that describe, again, the angle of inclination, or the angle that the femoral head makes with the shaft of the femur, and the angle of torsion, or the twisting that occurs in the femur in the hip. Now, the humerus itself, if we look at the whole anatomy of the humerus, we see that it is a long bone. It's, again, the longest bone in the upper extremity, and fairly sizable, fairly thick, and therefore fairly resistant to fractures. However, with falls on an outstretched hand, we can see fractures of this bone, although we do see fractures in and around the wrist and the forearm more frequently than in the humerus. But the humerus is considered to be a long bone. The proximal end, as I said, is called the head. And it's that rounded shape that we've talked about. The glenoid is the articulating surface of the humerus. It's the portion of the humerus that articulates with the glenoid cavity, and again forms about a half of a sphere. Just below the humeral head is an area that's called the anatomical neck. So the anatomical neck is sort of this narrowed area right here that separates the glenoid from the shaft. Now that's called the anatomical neck, versus this narrowed area is called the surgical neck. The surgical neck is below the kind of the whole head or the distal end of the humerus, below the tubercles, which we're going to learn here in a minute, as well as the glenoid and so on. The surgical neck comes from the name, most likely, that's where fractures more often occur. We don't typically see fractures of the neck here. We see fractures of the shaft here, or at times more distally down towards the elbow. Anteriorly on the humerus, which here is on the left-hand portion of the slide, we can also see a couple landmarks up on the head of the humerus called tubercles. There's a tubercle that is larger than the other. It's called the greater tubercle, and it's found on the lateral aspect of the humerus. If you palpate the lateral aspect of your arm, of your shoulder, that's basically what you're pushing on when you hit the humerus. So we have this lateral aspect, which is called the greater tubercle. In the anterior aspect of the humerus, of the humeral head, we also have a tubercle that's called the lesser tubercle. Between these two landmarks is a groove, and that groove is called the intertubercular groove. So either the intertubercular groove or the bicipital groove, because the long head of the biceps tendon, the tendon for the long head of the biceps, passes through that groove. The greater and lesser tubercles are going to be really important landmarks because that's where some important muscles attach to the humerus. Specifically, the rotator cuff muscles are going to be attaching in and around the tubercles, and they help to stabilize this joint. And then also, as I mentioned, the biceps is going to the long head of the biceps is going to pass between them in that groove. Clinically, they're pretty relevant because often people can get some tendonitis related to the biceps when it passes through this groove, especially in overuse type situations, and that can be an important landmark to be able to identify. The humerus as a long bone, the middle portion is called the shaft of the humerus, and we do have kind of a raised ridge that forms kind of a V shape on the lateral aspect of the humerus that is there from the tension that's produced by the deltoid muscle over time, and it creates this raised area called the deltoid tuberosity. It's basically a roughened V-shaped area on the lateral aspect of the shaft of the humerus. Now, the distal end of the humerus we're not so much worried about now. We can talk about that in an elbow presentation, but again, that's going to form the joint we call the elbow with the ulna and the radius. So the humerus, along with the scapula and the clavicle, will be the three bones that form the shoulder complex. In the next series of presentations, we're going to take a look at the joints that are formed by these bones, what type of motion is allowed at those joints, how those joints are held together, and how they all contribute to the overall function of the shoulder complex.